Welcome to my Physio Treat YouTube channel. Today's topic is cranial nerves. Cranial nerves are the nerves that originate from the brain, including the brainstem. There are 12 different cranial nerves. Cranial nerve relays information between the brain and parts of the body, primarily to and from regions of the head and neck, including the special senses of vision, taste, smell, and hearing. The cranial nerves emerge from the central nervous system above the level of the first vertebra of the vertebral column. Each cranial nerve is paired and is present on the both sides. The numbering of the cranial nerves is based on the order in which they emerge from the brain and brainstem, from front to back. The olfactory nerves and optic nerves emerge from the cerebrum, and the remaining 10 pairs arises from the brainstem, which is the lower part of the brain. The cranial nerves are considered components of the peripheral nervous system, although on a structural level the olfactory, optic, and trigeminal nerves are more accurately considered part of the central nervous system. Twelve pairs of cranial nerves. Olfactory nerve, optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducens nerve, facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, hypoglossal nerve. How to remember cranial nerve. Mnemonics. Only one of the two athletes felt very good, victorious and healthy. Only, olfactory. 1. Optic. Of, oculomotor. The, trochlear. 2. Trigeminal. Athletes, abducens. Felt, facial. Very, vestibulocochlear. Good, glossopharyngeal. Victorious, vagus. And, accessory. Healthy, hypoglossal. Olfactory nerve. The olfactory nerve conveys information giving rise to the sense of smell. Damage to the olfactory nerve can cause an inability to smell, anosmia, a distortion in the sense of smell, parosmia, or a distortion or lack of taste. Optic nerve. The optic nerve transmits visual information. Damage to the optic nerve affects specific aspects of vision that depend on the location of the damage. A person may not be able to see objects on their left or right sides, homonymous hemianopsia, or may have difficulty seeing objects from their outer visual fields, bitemporal hemianopsia, if the optic chiasm is involved. Inflammation, optic neuritis, may impact the sharpness of vision or color detection. Oculomotor nerve. Oculomotor nerve coordinate eye movement. The oculomotor nerve controls all muscles of the eye except for the superior oblique muscle and the lateral rectus muscle. Damage to the oculomotor nerve can cause double vision and inability to coordinate the movements of both eyes, strabismus, also eyelid drooping, ptosis, and pupil dilation, mydriasis. Lesions may also lead to inability to open the eye due to paralysis of the levator palpebrae muscle. Trochlear nerve. Trochlear nerve coordinate eye movement. The superior oblique muscle controlled by the trochlear nerve. This means the ability of the eye to look down and inwards is controlled by the trochlear nerve. Damage to the trochlear nerve can also cause double vision with the eye adducted and elevated. The result will be an eye which cannot move downwards properly, especially downwards when in an inward position. This is due to impairment in the superior oblique muscle. Trigeminal nerve. The trigeminal nerve and its three main branches, the ophthalmic, maxillary, and mandibular, provide sensation to the skin of the face and controls the muscles of chewing. Damage to the trigeminal nerve leads to loss of sensation in an affected area. Other conditions affecting the trigeminal nerve include trigeminal neuralgia, herpes zoster, sinusitis pain, presence of a dental abscess, and cluster headaches. Abducens nerve. Abducens nerve coordinate eye movement. The lateral rectus muscle controlled by the abducens nerve. This means the ability to look outwards is controlled by the abducens nerve. Damage to the abducens nerve can also result in double vision. This is due to impairment in the lateral rectus muscle, supplied by the abducens nerve. Facial nerve. The facial nerve control facial movement and expression. Damage to the facial nerve may cause facial palsy. This is where a person is unable to move the muscles on one or both sides of their face. Patients with Bell's palsy often have a drooping mouth on the affected side, and often have trouble chewing because the buccinator muscle is affected. The facial nerve is also the most affected cranial nerve in blunt trauma. Vestibulocochlear nerve. The vestibulocochlear nerve supplies information relating to balance and hearing via its two branches, the vestibular and cochlear nerves. When damaged, the vestibular nerve may give rise to the sensation of spinning and dizziness, vertigo. Damage to the vestibulocochlear nerve can also present as repetitive and involuntary eye movements, nystagmus, particularly when the eye is moving horizontally. Damage to the cochlear nerve will cause partial or complete deafness in the affected ear. Glossopharyngeal nerve. The glossopharyngeal nerve supplies organs, muscles, and other structures in your mouth and throat. It helps you taste food and sense pain in your throat. The glossopharyngeal nerve supplies the stylopharyngeus muscle and provides sensation to the oropharynx and back of the tongue. The glossopharyngeal nerve also provides parasympathetic input to the parotid gland. Damage to the nerve may cause failure of the gag reflex. Nerve. The vagus nerve is responsible for the regulation of internal organ. The vagus nerve provides sensory and parasympathetic supply to structures in the neck and also to most of the organs in the chest and abdomen. Damage to this nerve may result in difficulty speaking, loss or change of voice, difficulty swallowing, loss of the gag reflex, low blood pressure, slow or fast heart rate, changes in the digestive process. Accessory nerve. The accessory nerve supplies the sternocleidomastoid and trapezius muscles. Damage to the accessory nerve will lead to weakness in the trapezius muscle on the same side as the damage. The trapezius lifts the shoulder when shrugging, so the affected shoulder will not be able to shrug, and the shoulder blade, scapula, will protrude into a winged position. Depending on the location of the lesion, there may also be weakness present in the sternocleidomastoid muscle, which acts to turn the head so that the face points to the opposite side. Hypoglossal nerve. The hypoglossal nerve supplies the intrinsic muscles of the tongue, controlling tongue movement. The hypoglossal nerve is unique in that it is supplied by the motor cortices of both hemispheres of the brain. Damage to the nerve may lead to wasting, atrophy, of the muscles of the tongue. This will lead to weakness of tongue movement on that side. How to remember functions of cranial nerve. Mnemonic. Some say marry money. But my brother says big brains matter most. Some, sensory, olfactory. Say, sensory, optic. Marry, motor, oculomotor. Money, motor, trochlear. But both, trigeminal. My motor, abducens. Brother both, facial. Says sensory, vestibulocochlear. Big both, glossopharyngeal. Brains both, vagus. Matter motor, accessory. Most motor, hypoglossal. Thanks for watching the video. Please subscribe, like, and share.